Thanks for staying with us. So last week, June 19th, was World Sickle Cell Day. It is set aside to raise awareness about this genetic disorder that affects millions worldwide. Sickle cell disease is a lifelong condition that requires ongoing medical care and support. The day was dedicated to educating ourselves again and others about the causes, the symptoms, and treatment options by promoting awareness. And by understanding this, we can improve the lives of those affected and work towards a future where everyone has access to quality care. So today on the show, we're going to be having with us a guest join us via phone to talk about this sickle cell. Is Professor of Hematology in the Department of Hematology and Blood Transfusion, College of Medicine, University of Lagos, and consultant hematologist at the University Teaching Hospital, LUTH. Welcome with us, Professor Titilope Adeyemo. Welcome to the show, ma'am.
Good morning.
Good morning. Are you there?
Good morning.
Good
morning.
Good
morning. It's my pleasure to be with you this morning.
We're happy to have you.
Happy to have you. So every year we discuss sickle cell because it's an important conversation to have to remind our viewers on how to take care. So just give us a bit of an update, because every year we remind ourselves what sickle cell is. But is there any, let's start on the basics. What is sickle cell again? For those who don't even know what it is, let's just start on the basics. What's sickle cell? And then if there are any medical updates, especially since last year that we've had this conversation.
All right. Thank you for inviting me to the show.
Yeah.
So again, I would say that I will remind our viewers and people who don't know that sickle cell disease is a group of inherited blood disorders. It is inherited, and therefore it is a lifelong disorder, except the individual gets a curative therapy.
Okay.
But that is still not widely available. So most people have to live with it once they are born with it.
Okay.
It is, as I said, that it's inherited, and therefore it results from a genetic mutation of the hemoglobin, which is the oxygen-carrying protein in our red blood cells.
Okay.
So once we have a mutation there, we have an hemoglobin S instead of a normal hemoglobin A. People who have hemoglobin S in double dose are said to have sickle cell anemia. But if they have hemoglobin S and any other type of hemoglobin, they will call it sickle cell disorder or sickle cell disease.
Okay, so
the problem with just let me land quickly here. The problem with having that hemoglobin S is that unlike the normal hemoglobin A, hemoglobin S is prone to sickling. It's prone to not being flexible. And under certain conditions become rigid and sticky and not flexible, and therefore does not allow good blood flow to different parts of the body. It gets stuck in blood vessels, blocking blood flow. And that gives rise to all the symptoms and signs and symptomatology of sickle cell disease, the problems of sickle cell disease.
Okay, so you already started us off with it, but I just wanted to ask that we take some time to talk about the ramifications of sickle cell, because I know that there are different types. So could you speak to, how these types of sickle cell diseases vary in terms of how they manifest or the extent of their severity?
Yeah, well, depending on the type of hemoglobin variant that is inherited with the sickle cell. So if one inherits the sickle cell in double dose, we call it sickle cell anemia, and that is usually the most severe.
Okay.
If people inherit the sickle cell with hemoglobin C, another hemoglobin variant that is not normal, we call it hemoglobin SC disease, and that is also a form of sickle cell disease, but usually not as severe. And there are so many other thousands of variants that can be inherited with this abnormal hemoglobin S.
Okay, so are you done? Go ahead.
So depending on the type of variant that is inherited with hemoglobin S, that also impacts on the severity. So again, when the S is inherited in double dose, that give us hemoglobin S or sickle cell anemia, and that is by far the most severe of all types of sickle cell disease, and that is actually also the most common type of sickle cell disease.
All right, so the tackling of sickle cell and the awareness created around sickle cell before now wasn't this much. Would you say there has been an advancement in the creation of awareness in this sickle cell disease campaign. Has there been any change so far? Can you give us the figure now and how it was previously? Is there a difference?
Well, actually, before the 1990s or early 2000, the awareness of sickle cell disease was very poor. Despite that, it affects millions of people worldwide. Well, most commonly in people with ancestry from sub-Saharan Africa and the Middle East and India. But about 300,000 babies are born with sickle cell disease annually.
Wow.
And worldwide, between 7 and 10 million of people, between 7 and 10 million people are living with sickle cell disease. Yet, before the 2000s, early 2000s, the awareness was very poor. So, the World Health Organization and several other bodies, including the West African Health Assembly, had to come together to say we have to recognize the day to use to bring awareness to sickle cell disease so that more people are aware about what is the causes, how it is inherited, how it can be prevented, or how people can live with it and manage it. So gradually the awareness is improving, but we are still far from where we should be. Because often you see people, we see couples coming together without being aware of their genotype and having babies who have sickle cell disease, even in this 21st century. So we need to create more awareness, no doubt. The awareness is still far from where it should be. And that is why it is important to continue to celebrate the World Sickle Cell Day and the Sickle Cell Awareness Month, so that, which is in October, so that more and more people will be aware about how we get sickle cell disease, how we can manage it, how we can prevent it, and how people can live with it.
Okay.
In Africa, would you say that, yes, you've mentioned that the people with sickle cell are majorly with African descent, right? But most times I realize that when they travel out of Nigeria or out of Africa, their health seems to kind of like balance out. So is it a function of the environment, or there's something else aside from their blood that has a role to play in how often they fall sick?
I wouldn't say that when people travel out of this environment, their life kind of balance out. Actually, we know that there are stressors or triggers of the sickle hemoglobin. Okay? So once they are exposed to these triggers or stressors anywhere in the world, then they are going to have the symptoms and problems and the complications of sickle cell disease. So we do have patients who leave Nigeria and goes abroad to where it is extremely cold or much colder than in Nigeria, and they start to have more complications of sickle cell disease, more crises. So some of the stressors that we know include extreme heat and extreme cold. So it can happen anywhere. So it's part of the health maintenance strategies that we tell people living with sickle cell disease, okay, to avoid this extreme. Okay, so when you're in a cold region, make sure you keep cold. If you're in an extreme warm region, make sure you hydrate and you keep cool. And there are so many other stressors. One of the things that you may reflect on, that may indicate that people who go there tend to have more balance, is the exposure to infection. Actually, we know that in the tropics, because of our very warm climate, we tend to have more infections and infectious diseases around. Like in the cold climate, where most microbes cannot even survive because of and we know that infection is one of the triggers. So when people live in this warm climate, they may get exposed to more infection, come down with infections, and that is one of the stressors of sickle of hemoglobin S that makes it to sickle and to have the problems.
Professor, there's a young couple listening to you right now, and they're telling themselves, both of them are AS, and they just believe that 2025, there are better solutions or there are better options for them to explore because they are in love, they want to get married, they understand the issues. However, they are trusting that the medical science should have advanced to the point where it can help them. So what kind of advice would you give somebody who is willing to get into the relationship because that's the person they really long to be with and they just cannot see themselves with anybody else? So what kind of advice would you give them? What are the options out there for them?
Yeah. Thankfully, we have some advances in medicine. people can make the decision about how to have babies and when to have babies and what methods, what can they use to prevent them having babies with sickle cell disease. Now we have available prenatal diagnosis. But what is most critical, just irrespective of what you want to do moving forward, is that you have a clear eye about what you are going into. If you have the AS genotype and your partner has the AS genotype, you have to understand clearly that you have the risk of having children being born with sickle cell disease. And it's not just 1 in 4 children. It is 1 in every 4, one chance in every 4 pregnancy, in every pregnancy. Okay, that is the risk. So people can have 4 children with sickle cell disease, and people with couples with who are AS can come together and not have children with sickle cell disease. But there must be clear high that there's a high chance, a 25% chance. And that means that what are our options? Now we have prenatal diagnosis. So that means in early pregnancy, the genotype of the child can be identified. And people can now make informed decisions about what to do. Wow. Okay, if I have this baby who now happens to have the sickle cell disease, these are the care I must put in place so that they do not suffer from the disease. I mean, they do not suffer from the complications of the disease. They need to be registered early in care. They need to be to have all the preventive strategies we have in place for newborns and in early infancy, so that the child can grow up without having suffering.
Okay.
Too much from the sickle cell disease or having all the problems in sickle cell. I also now have pre-implantation genetic diagnosis, so people can choose the kind of babies they want to born. Okay, so they can choose that. They can choose the ovum or the egg or the fertilized egg that does not have the sickle cell disease and implant that, so that they do not give birth to a child who has sickle cell disease. So there are now advances.
Okay.
But this of course has cost implications, and people have to be clear-eyed and informed about what it involves.
Let me go on a very short break, Professor. When we come back, we wrap up with you. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. We still have our guest on the show, Professor Adeyemo. Abigail had a question for you.
Yeah, blood donation, does it have any help for patients of sickle cell?
Blood donation?
Yes.
Yeah, significantly.
How?
And by the way, the World Blood Donation Day is on the 14th, where we celebrate the awareness for people to donate blood. And the World Sickle Cell Day is on the 19th. So they are quite closely linked. Because one of the major treatments people with sickle cell disease must have is blood transfusion.
Wow.
Okay, because of the inherited inherited condition that they have, their red cells do not last the normal lifespan of a red cell, which is 120 days. For people with sickle cell disease, their red cell lifespan is just about 10 to 30 days maximum. So they usually have low blood level, low hemoglobin level, or what most people would normally call low PCV. They're usually anemic, chronic anemia. Okay, it's one of the manifestations of sickle cell disease, and by far it is one of the reasons why they have so many of the other complications that they do have.
Okay.
The liver disease, the lung disease, the heart disease that they may have is as a result of the chronic anemia.
Okay.
So
Just
they
to
are
add to
usually
Abigail's
treated with a
question.
lot of blood transfusion, and that is why people donating blood is also supporting people with sickle cell disease.
Okay.
Okay, so I'm wondering, for people who maybe for moral, ethical, or religious reasons do not or are averse to blood transfusions, are there other medical options that are available to them? For instance, I personally am an advocate of bloodless surgery. So we've seen that in the course of medicine has advanced to the point where bloodless surgery is becoming a big theme, right? And so we have blood expanders, we have blood enhancers. Are these things that are feasible, or do we have such provisions for sickle cell patients who say, no, I do not want blood transfusions? What options are available to people like that?
Yes, there are other options because there are also other advances in therapy. But there is a but.
So what's
most of those options are usually not as quickly effective. So when a patient has an acute complication of sickle cell disease, acute, like let's say a patient with sickle cell disease got a stroke, which is also one of the common complications they do have, by the way. All other forms of therapy are not going to work at that point in time. You have to do what we call a quick blood exchange transfusion if you're going to be able to make any significant impact in the complication. So quite often, most of the acute complications have to be treated with blood transfusion, and the other options don't work. But if we can prevent those complications from starting, and that is where the other options will come. Like, for example, the usage of hydroxyurea. Okay? Hydroxyurea do reduces the frequency and the amount of blood transfusion patients with sickle cell disease will need if they're on regular doses and optimal doses of hydroxyurea.
Okay.
And there are also other treatments being investigated and being evaluated for their efficacy for patients with sickle cell disease. But by and large, hydroxyurea is one known drug that has shown quite robust impact on ameliorating the condition called sickle cell disease.
Okay. So what resources are available for someone who is listening on this show, watching this show, and saying, I'm a sickle cell patient, I need help, I need resources, especially understanding the fact that you work with the government, right? So what has the government done to provide resources for people living with sickle cell anemia? Thank you.
Yeah, the government, the federal government of Nigeria, it's beginning to also put to the fore the condition called sickle cell disease. Before now, there's been so much distraction. The focus of government is usually on the infectious diseases, the communicable diseases, the malaria, the HIV, the tuberculosis. But in recent times, government is beginning to put a bit more focus on the non-communicable diseases that sickle cell disease belongs. It's non-communicable, even though it is inherited. Okay, so government is beginning to pay a little more attention to sickle cell disease, but there's still a long way to go. In terms of awareness, the federal government of Nigeria also does recognize the world as World Sickle Cell Disease Day. They have also made efforts to establish 6 comprehensive sickle cell disease centers in all the 6 geopolitical zones in the country, but by far and large, that is just still a tip on the iceberg. People with sickle cell disease do need a lot of support, because sickle cell disease does impact significantly on their life and the lives of their loved ones. There is a lot of economic barrier to them seeking care. So we need to have a lot of investment investment in the care of people with sickle cell disease so that they can access care. They should be able to have subsidized medication. They should be able to have subsidized care. Because the lifelong disease, they have to keep spending money, okay, on maintaining their health. And health care costs money. And it's a big barrier. And that is where we need governments, the non-governmental organizations, the philanthropies to come in and support the care of people with sickle cell disease.
Thank you very much, Professor. We have to leave it at that. Thank you so much for always joining us every time we call you to help us get better education, enlightenment on this matter of sickle cell. I'm sure those who have heard us today have learned a few things. That's all we can take on today's show. Hope you learned a few things. We'll see you tomorrow. Bye for now.
Bye.